the pharmacy business with 3 hard-working chemists. We'll be speaking to the owner of Ireland's first PPE shop out in Dunleary, plus why the here, the now and the where of work has changed forever. So, you're welcome back. With the majority of the country was in, while the majority of the country was in lockdown, almost all the nation's pharmacies remained open to provide essential services. How is the sector faring now, 6 months down the line? I'm delighted to be joined this morning by Darragh O'Loughlin. He's the Secretary General of the Irish Pharmacy Union. He's also the owner and director of Medwell Allcare Pharmacy in Tuam, County Galway. Also joining me is Gráinne O'Leary. She's the owner of Gallery Quay and Hanover Quay pharmacies here in the city in Dublin. And Eamonn Brady is the owner of Wheelahan's pharmacies in Mullingar. Darragh, I might start with you, if I may, as the Secretary General of the Irish Pharmacy Union. Can you give us a kind of a synopsis of where the sector is now? I know that you were very busy as an industry right through the lockdown, frontline service, very much part of all that. You did have a surge in your business back then. Where is it now, and how are chemists feeling, and how are they doing?
Yeah, Bobby, it's been a bit of a roller coaster ride since the first lockdown. Even as we were coming into that lockdown that I think we all knew was imminent within days, people were seeing the news reports coming out of Italy and out of Madrid and Spain and even New York. So there was a massive increase in demand for medicines, to the extent that we were afraid that we'd have medicine shortages, because while there's plenty of stock in the country, it's not all on pharmacy shelves. It's in the supply chain, and the supply chain struggled to keep up with the demand from the public. So we had to manage people's prescriptions very carefully, make sure that individuals weren't stockpiling. Pharmacies were trying to make sure that all of their patients got enough of the medicine they needed, rather than some of them getting all of it. The wholesale system worked flat out, in fairness to them, but they just didn't have the capacity to deal with the demand. So we were seeing supply interruptions in pharmacies. You know, there was 1 week we couldn't get inhalers for asthma, not because they were in short supply, but because the wholesalers couldn't get them from the back door onto the vans. So this was a massive increase in business. Our staff were stressed out with queues out the doors. There was this virus that nobody knew anything about. We weren't making any money, so we had queues out the doors, but we weren't selling anything from the front of the shop, and that's where the profit is. That revenue helps to drive the business.
So the retail arm, the beauty,
died.
all under...
Actually, the pharmacists themselves, they shut it off with plastic sheeting, they taped it off. They were trying to keep people apart, no loitering, no browsing, no hanging around the pharmacy, because we were all afraid of infection. Pharmacies had to go and invest in screens, and you've got your screens up in here, Bobby, but pharmacies were the first to put those in. We had to figure it all out for ourselves, because even the government hadn't caught up with what was needed at that stage. This was
you may as well get it off your chest, because I know there's an anger there among pharmacists about having to go to all that cost, and while frontline services were greatly supported, the chemists seem to have been forgotten.
Completely forgotten. And you're right, Bobby, there's a seething resentment out there that the Department of Health effectively cast us out there, left us on our own. We were managing the medication needs for the entire population and doing a damn good job of it under very pressurised circumstances, and they gave us zero support. We looked north across the border at what was being done for pharmacies up there, where their Department of Health came to the table and said to them, look, what do you guys need? Well, we need screening, we need extra money for extra staff, we need security, we need somebody to fund all the deliveries we're doing to people's houses. Everybody over 70 was cocooning at home. We had to deliver the medicines to them. The Northern Ireland government comes to the table with a substantial package and says, well, we're going to bump up your normal monthly payments where we pay you for the medicines you've given out. We bring it forward by a month, so there's some cash flow, and we're going to give you a grant of 20 grand each roughly to pay for your screens, your security, your extra staff, your delivery service and so on. We looked for exactly the same from our government, no more and no less, and we got precisely nothing from the Department of Health except we were told to go and fend for ourselves.
Okay. That being said, you've got it off your chest, you've spoken about it very eloquently. I want to bring in our second guest, Gráinne O'Leary, from the Gallery, from Hanover Quay and Gallery Quay. Yeah, I thought it was Gallery. You're very welcome, Gráinne. You're a business, like any business, you do happen to be a pharmacy, but you're in metropolitan Dublin, so footfall has been surely a serious issue for your business, Gráinne.
Yeah, it's been decimated, unfortunately, because we have no working population around anymore. And also we've loads of apartments around us, but they're empty now because the people that lived there worked there. They've all gone home. They're not paying €2,000 rent to live near where they work when they don't actually have to go to work. So they're gone back home to the country, or their different countries. So they're just not around. It's a ghost town.
Wow. And what about civil servants? What about, I'm just trying to look for some, is there any bright lights on your horizon, or is it just have you just seen the actual footfall just being decimated? Oh yeah,
it's down 90%. The car parks are empty. You wouldn't get into a car park. There's no so I'm down near Grand Canal. There's nothing happening in the theatre. There's very little happening in the hotel. There's very few people going to the restaurants. That would have been lunchtime business for all the solicitors and everything that are around the area. So there's nothing around. There's no tourists.
Yeah.
So it's all minus.
And then, which is probably a little bit of a double whammy for you, the role of the pharmacist, during the difficult time, people were asking you to fulfill, functions that would normally have been fulfilled by a GP. If the GPs were going on the phone, you're spending a lot of time with. You say that it's disheartening that GPs get a €30 compensation from the department for every phone call consultation they take, but pharmacists get nothing. This is on Dara's point of being left out to dry.
Yeah, well, I mean, we were deemed an essential service, and we really were an essential service. We got what can only be described a tsunami of phone calls and emails, people looking for advice and reassurance. And then we noticed, due to this social isolation, that people wanted to talk in person. They wanted to see another human being. And so that's what we did. We were there as a human person to try and reassure people and try and say to them, like, every time they came in, like, people were short of, a cut finger going, well, can I get COVID from this? Yeah. And I go, no, it's a cut finger. Like, normal people that are very reasonable have lost all...
Because people are frightened.
Oh, yeah, they've lost all sense of common sense. And you just have to... Once they speak to another person in person, it's not the same as Zooming or telephone calls. When they see you and they can look at you and you can reassure them and say, listen, this is accurate information. It's not something you've read on Google. This is accurate information. These are the facts.
And again, as a business, parking the pharmacy piece of it, you're a business with 2 shops that pays rent. You didn't really get any favours from your landlord.
Well, there was a recent article in the papers that said that at least 25% of small business are going to fail because of the cost of rent arrears. And that has a knock-on effect to employees. They lose their jobs, suppliers because they've no one to supply to, and of course to the landlords because no tenants, no rents, which ironically will then have a downward pressure on rents. So instead of devastating businesses like ours and people's lives, the government needs to step in and support them now.
Okay. Very, very, very well said, Gráinne, and I really do feel for you. Let's talk to Eamonn Brady. He's the owner of Wheelahans Pharmacies down there in Mullingar. Eamonn, how are you?
Not about Bobby. How are you?
The conversation with the 2 pharmacists so far has been quite dark. How are you feeling, and how is your business, Eamonn?
Yeah, it's like every business with massive challenges. I have 2 pharmacies in Mullingar, and one on the High Street in the centre of town, and one in Mullingar Business Park. The one in my pharmacy and Business Park, we specialise in supplying nursing homes. So nursing homes, as it's well known, as their own challenges, over the course of especially early days of the pandemic, and we were at the heart of that, trying to support the nursing homes and the residents at the time. It's like, I suppose that's a start. It took the HSE a few weeks to get their act together, I suppose, with PPE. So, like, a lot of our role was trying to get help nursing homes get PPE, like it's simple face masks, and at the time prices were gone through the roof. So that was a massive challenge, on its own. We have many of our patients, unfortunately, did pass away from COVID in nursing homes. So that was its own unique challenge. It's like we knew many of the patients personally. We were speaking to the families, trying to give advice. The families couldn't go into the nursing home, so they were coming to us to help with advice. On like even as simple down to, unfortunately, palliative meds at the end of life, and so yeah, it was.
Yeah, that's very distressing, Eamonn. And tell me this, Eamonn, has there been a big move now to delivering prescriptions? You've got 5 vans on the road. That sounds to me to be a fairly serious operation in terms of its scale and size, about delivering medicines, I suppose, where traditionally somebody might have come to you. Do you now have to go to them?
Yeah, so we've always delivered. For the last 18 years, since I've had Whelan's, we've delivered meds to nursing homes. We expanded that, and because we've had vans on the road, we deliver to people's homes. So we traditionally always delivered to people's homes within Westmeath, within say a 30 to 40 mile radius of Mullingar. But that literally went up tenfold during the height of the pandemic. And it's and we're delighted to be able to offer the service. It did create its own challenges. I suppose we were lucky that we had the infrastructure there to offer it. People really appreciate it. They and like that Gráinne alluded to it there. People were ringing, the phones never stopped. Like that was, and I suppose people were stuck at home. Weren't especially our older customer base. In some cases nobody to talk to, so they'd be ringing us with nearly more social. Service.
And that's all time and interaction.
Yeah. So we're delighted to be able to offer it, but it created its own challenge, and that, as Dara alluded at the start of we had the opposite problem of most business where we had such a surge, but it wasn't extra business. It was just people were
displaced business. Yeah, it was just they were pre-ordering, and then we had a challenge, as Dara alluded to, we didn't want the medicines running out, so we had to manage that from sure that people were looking for 6 months prescriptions because nobody knew at the time what the future was. So we had to manage that, try to explain that let's bring Dara back in. Dara, just that surge that Eamonn described there, and he's saying that it's not new business or it's not extra business, that just displaces. Then was that surge followed then by a big void?
Absolutely, yes. That massive surge in the second half of March, maybe going into the first week in April, was followed by a huge dip because people all had what they felt they needed at that stage, and they'd been reassured that more medicines would be available when they were subsequently required. So we went from this massive surge of business during which we made no money to a huge dip when we hardly saw a customer or a patient coming into the pharmacy. And then lockdown had gotten much tighter at that stage, so the pharmacies were empty apart from staff.
Okay. Is there any upside here? Things like the digitalisation of prescriptions is, again, I'm talking to my own pharmacist now in Dún Laoghaire, Deirdre. She was saying to me that there's a huge positive now around the fact that you can get your prescription by email. There's no working out doctors' handwriting, all that sort of stuff.
That's right. And look, we're not here to criticise doctors' handwriting, but what we have discovered in Ireland long after the rest of the world is you can do a lot of this electronically. So for whatever reason, we've had an e-health strategy in government since 2012. It's written down, it's formal, you can find it on the website, lovely document. They've done nothing. All of a sudden the pandemic strikes, and yes, there is always a little bit of positive in any disaster. They suddenly realise that we can do this stuff in Ireland as well. So GPs are now securely emailing, so it's not Hotmail or Gmail, securely emailing prescriptions directly out to pharmacies. We get them electronically. We can then print them out and deal with it as a normal prescription. But it's an ad hoc solution, Bobby. It's real stick and plaster stuff. What we really need to do is jump from that to a proper e-prescribing electronic health system like they have in most other Western European and developed countries.
And how short are we in that regard? What are we not doing that somebody in Sweden or wherever is doing?
The funny thing is, I think we'd have most of the infrastructure. We definitely have the capacity. Sure, Gráinne's pharmacies are surrounded by the finest IT minds in the world. We have the capacity and the capability, but nobody's said do it. So there's no budget behind it. There's no impetus behind it in government. I'd say if they started on Monday, Bobby, we'd have a proper e-health system in this country within 18 months to 2 years.
But doesn't it make sense, Tara, to go that route? Again, if it saves time, it saves money, it saves mistakes, all those kind of human flaws that are in a manual system.
That's right. And it means that when you go to a hospital for whatever reason, that they have access to what the GP treated you for and the meds you got in the pharmacy.
Yeah.
Last time I was in hospital, I had to go from one clinic to another clinic on campus as an inpatient, carrying my own file with me because there was no other way for the information to get from the consultant at the front of the hospital to the consultant at the back of the hospital.
Okay. Gráinne, where do we go now? We've Dublin now gone up to level 3. It's probably going to mean even less people in the city centre over the next 3 weeks. What's your own vision, or can you even have a vision at this stage?
Well, I really think it's in everyone, both landlords, government and business interests, that a solution is worked out as soon as possible. Businesses are crying out for support, but the government and landlords need to engage. Where the government could drive this, the businesses on a whole, have had very little success engaging with landlords. There's no need for landlords to engage. They're going to get what they want, they think. But it's a bit like a seriously ill patient. If you don't treat the seriously ill patient now, then there is no hope of recovery. You'll just kill them. And, if you destroy small business in the city centre, you destroy its personality. And then you'll destroy tourism, and also then you'll destroy the desire of people wanting to come and work and live here. And that's what makes us such a dynamic environment. You'll destroy all that.
No, you're so right. You're so right. Last word to you, Eamonn, Brady. Mullingar, again, you say you have 2 pharmacists there, one in the main street and one slightly outside town. So do you see a different future for both businesses, Eamonn?
Yeah, it's the high street. The high street has its traditional challenges in the last 10 years with online, and that I suppose the pandemic accelerated that. And saying that on a positive, like from the likes of small rural towns like Mullingar, where within the hinterland of Dublin, I could feel Gráinne's pain with Dublin. We I suppose with more people work from home, probably 40% of Mullingar's population work in the Greater Dublin area. So a lot of people work from home. So we have seen a pick up in business. These people are shopping more locally, and it's like, well, we've had massive challenges in rural Ireland in the last few years from the rural or high street, and you've done a good job at highlighting it, Bobby, over the last few years. It's nearly come full circle in one way. Despite COVID, and it's going to be massive challenges. Look, like the likes of the rest of Ireland could be in lockdown or semi-lockdown in Dublin in 2 weeks. We don't know. Yeah. But looking at the positive, there's opportunities for rural Ireland for people.
Yeah, no, wherever people are living, I think, and working, there is opportunity. Eamonn, every success to you, and thanks for joining us today. Also want to thank Gráinne O'Leary from the Gallery Quay and Hanover Quay Pharmacies, and indeed Darragh O'Loughlin, the Secretary General of the Irish Pharmacy Union and Owner-Director of Medwell All Care Pharmacy over there in Tuam. Thank you all for joining us, and we wish you all every success. Up next, why working from home isn't just a phase.
Down to business on